So I would suggest that we start the meeting. I do apologise to those of you at the far end who I can just about see with a pair of binoculars that you are so far away. And I'm not up here on my own because I'm suffering with anything that's contagious. Well, I don't think I am anyway. So can I ask that the live stream is started, please?
Yes, Chair, I can confirm the live stream has been started.
So I'd like to welcome you to this meeting of the Health and Wellbeing Board being held on Monday the 17th of March 2025. For those present in the meeting room, if the fire alarm sounds, please leave the building by the nearest exit and make your way to the fire assembly point in the car park. The agenda papers and other relevant information for this meeting are available for viewing on the Herefordshire Council website. The Council is streaming this meeting live on the Herefordshire Council YouTube channel and is making a recording. Others are permitted to film, photograph and record meetings. As there are no members of the public, we will not be, there won't be any disruption to them. And we don't need to require any member of the public to raise their hand to say they object to being filmed, as there isn't anyone here. Can you please ensure that your mobiles, laptops and other devices are turned to silent? For participants in the room, please raise your hand to indicate that you wish to contribute. When invited to speak, press the button on the right of the microphone unit and speak directly towards the microphone. Please remember to turn your microphone off once you have finished speaking. For remote participants, in attendance remotely, can I request that you use the raise hand feature within the system if you wish to contribute and to introduce yourself when called upon. We now move on to the first item on the agenda. So the first item is apologies for absence. Do we have any apologies for absence?
Yes, thank you, Chair. We've had apologies from board members Kevin Compton of Herefordshire Safeguarding Adults Board, Susan Harris of Herefordshire and Worcestershire Health and Care NHS Trust, Dr Mike Hearn of Herefordshire General Practice, Tina Russell, Corporate Director for Children and Young People, Simon Trickett of NHS Herefordshire and Worcestershire Integrated Care Board, and Superintendent Helen Wayne of West Mercia Police. And I note that we have the Vice Chairperson, Managing Director of Wye Valley NHS Trust, Jane Ives, joining us remotely, and also Christine Price from Health Watch Herefordshire, also remotely, so both can participate but not vote.
And is anyone in the room aware of any other apologies to record? No? So item 2 is name substitute, and have we got any other name substitutes?
Yes, Chair, we've got Dr Lauren Parry's joined us on behalf of Mike Hearn from Herefordshire General Practice.
Thank you. We now move on to item 3, which is declarations of interest. I wish to receive any declarations of interest from members of the board in respect of item members on the agenda. Do any board members wish to declare any interests on any agenda item? No? Thank you. Next item is the minutes of the meeting of the 9th of December 2024. The minutes document of the meeting held on the 9th of December is included in the agenda pack. No matters of accuracy have been notified to the monitoring officer. Are you content that I sign the minutes as an accurate record? Yes? Thank you. Next item is questions from members of the public. To receive any accepted written questions from members of the public. No questions have been received from members of the public on this occasion. Item 6 is questions from councillors. To receive any accepted written questions from councillors. No questions have been received from councillors. We now move on to item 7, which is the progress on the Best Start in Life Action Plan. And this is to provide an update on the progress of the implementation plan for the Health and Wellbeing Board's strategic priority of giving our children the best start in life, focusing on 0 to 5-year-olds. It will be introduced by Lindsay McCarty, with contributions from Julia Stevens, and then we will provide questions, etc. afterwards. Thank you.
Thank you, Chair. Yes, we brought this paper today. It is now a year and a half since the Health and Wellbeing Strategy was launched, and the implementation plan for Best Start in Life was approved in March 2024. So we're just about a year in terms of where we've got to. And I think the key things to note is both the progress that's been made, some of the challenges, and also kind of recommendations for ways forward, particularly in terms of how we are recording and reporting on some of the progress. Julie is going to go through some of the more detailed actions that have been taken forward and where we've made substantial progress, and you'll see in the attachments to this paper that the implementation plan is showing green on the whole. So partners have worked together really hard to deliver what was agreed a year ago. The outcomes dashboard, which is also attached to the paper, was developed to provide some proposed trajectories as to where we need to get to. And I would just ask the board to bear in mind that the plan is a 10-year plan. The implementation plan is to cover the 2-year period, 23 to 25. But actually, we want to make sure it's a rolling programme of actions to take forward, but still keep in mind some of the trajectories which relate to the public health outcomes framework, and from which the strategy really was developed. Based on the most recent child health profile that's produced by OHID, the Office for Health Inequalities and Disparities, there are some key areas where Herefordshire is showing a RAG rating of red against national averages or potentially West Midlands averages. And those are in relation to dental decay in 5-year-olds, our MMR second vaccination at 5 years, DTaP and IBV booster vaccinations at 5, vaccination coverage of our children in care. Those are small numbers, but they're still really important. And premature births less than 37 weeks. The data for that, there's a bit of a lag on that one, so I can't update it on it. The plan's been in place, as I say, for a year, and we've also got some actions that we'd like to take forward in relation to the above red indicators. So we've got some dedicated work going on around particularly child in care vaccinations, but the whole vaccination programme. We have been ramping up the oral dental health supervised toothbrushing and introduced the Healthy Tots element of the Healthy Tots Healthy Schools programme, which will focus very much on oral health. We also have the newly introduced 4 to 6 month oral health and healthy weaning check that was introduced last year with the new 0 to 19 health visiting school nursing programme. In terms of amber indicators, which shows that Herefordshire is not significantly different from the England averages or targets, these relate to mothers smoking at a time of delivery, overweight children at reception and year 6, children achieving a good level of development, and our free school meals children reaching good level of development at reception. We want to keep these in mind, and actually I have got a little bit I can update you on in terms of the smoking, which relates to what I'm going to be suggesting we do in the future, which is that currently our data on the child health profile is showing that our smoking at time of delivery is at 8.4%. You'll see that in the attached tables. Actually, at a meeting last week, the public health midwife, Arwyn Nixon, was reporting that the data she's holding currently, local kind of service data, is showing that we're just under 7%. We're at 6.7, I think, percent. So there's a bit in here for me, which is the data that we get from the public health outcomes framework is robust data. It's been cleansed. It's gone through all the national processes, and it's Herefordshire only data. but actually it's often quite old. So even the latest data is sort of 23, 24. And if we want to be looking at, are we actually putting our actions where they need to be? Are we able to see the trends more quickly coming through than they might be showing through the national frameworks? Then it would be helpful to use uptake data at the local level, use some other proxy indicators as well. So whether it's numbers coming through or feedback from service users or looking at case studies, I think we would like to be bringing that together so that we can be reporting that here much more quickly as we get those findings. That's not to say that we don't still want to use the public health outcomes framework and the trajectories that we've got, because I think it's important over the longer term that we can also see that progress through that data. But I think we want to be a little bit fleeter of foot at the moment in terms of how we can see what's going on and how we can report that. But it will need an element of sharing of information across the partnerships involved. In terms of some of the green areas, just quickly, I will highlight is the introduction of the Healthy Schools programme. And the Healthy Tots coming along, and we would like to expand it at some point to further education as well, sixth form and further education. We have a number of SEND champions that have been trained through the 0 to 5 service and representation in each of the PCN areas, which has been quite a difference from previously. As I say, Julia will provide a bit more information in terms of where we've got to. But there has been huge progress, I think, in terms of how the partnership is working, how the Best Start in Life group is pulling together, and a real keenness to start using data that we don't normally collect. So, for example, our early years settings collect a lot of information. Our nurseries have a huge amount of information about our children. And we don't routinely draw that in anywhere. And just a very simple example of that is at a meeting last week, the early years lead was talking about the safer sleeping policy, which is introduced through the NHS Saving Babies' Lives bundle, really, was developed for that. And she was saying that they've got some good policies, good recommendations, but actually it doesn't say anything about sleeping in pushchairs. And in quite a lot of her nursery settings, she knows that young children are being put to sleep, babies, in pushchairs, which isn't kind of gold standard. So actually I raised that at a perinatal mental health meeting 2 days later, and it was at the CDOT meeting, Child Death Overview Panel meeting, and they're going to be rewriting the policy, and that will get written into it. So that's a really, really small example of how information is being pulled through Best Start in Life and will have a direct impact in terms of policies that can be carried out through the county, and the early year settings will then have to implement as part of a kind of gold standard approach. I don't think there's probably anything more that I'd want to say other than, I think it's bedded in really well. I think we've got more to do, a lot more to do, but actually there's a huge willingness, a huge enthusiasm around that Best Start in Life group, and we want to really look to establish it further and make even more progress that we can report on in due course, but particularly in another year's time. We also need to review the actions for the next 2 years over the course of this year. Sorry, I'm starting to lose my voice now. Thank you. Can I hand over to Julia?
Oh, that was timely. Welcome, everybody. My name is Julia Stevens, and I'm the Public Health Lead for Children and Families and delivering on the Best Start in Life. So I'm just going to give you some examples of where the Best Start in Life is really progressing on the ground, where we've got some really good outcomes for our children and young people under 5. Lindsay highlighted some of them. Our Healthy Schools programme now has 45 schools that have signed up to the programme. We've launched it to our primary schools and our nurseries, and we will shortly be launching it to our high schools and sixth form colleges, possibly other colleges in Herefordshire, but at the moment we feel there's still further work to do on the criteria for that. That's a bit more of an in-depth piece of work that we'll be rolling out. But I think what's really useful is that the Healthy Tots, which is obviously aimed at getting our nurseries to work towards a standard in regards to health and well-being within the nursery, and it ties in with the EYFS education Ofsted criteria as well, is that it's really highlighting some of the concerns that we have in nurseries around the babies in pushchairs, for example, around the types of food and drink that they're being given. We heard recently that some children are arriving at these nurseries still not being able to eat properly because they've been brought up on very soft, pouchy type foods, sucking from pouches, baby food already made that you can purchase over the counter, which means that they're not actually getting the mouth movements. All sorts of things, you'd be surprised. So the Healthy Tots programme is really building in. And when we see things like this that are being highlighted to us, we're in a position where we can put in some training for those nurseries to get them up to a certain standard where we can say this is acceptable but this isn't. So that's a really good example on the ground of some things that are happening around that. You'll be aware that supervised toothbrushing has hit the headlines, with the government now actually rolling out a programme in targeted deprived areas for schools to take up funding for supervised toothbrushing. You'll be aware that we have been doing that in Herefordshire for about 2 years now, and we have a huge proportion now of our schools who do supervised toothbrushing, and we do have more coming forward. We're lucky that we're working with our partners at NHS Improvement, in that there is some funding available that we might be able to tap into to be able to roll that out further in Herefordshire. We just need to kind of negotiate and determine some resource around the delivery of that and capacity. But it's not something that we'd really want to say no to, because obviously in an ideal world, we would want every school in Herefordshire to be able to offer that to the children, because that in the long run will have a huge impact on our oral health challenges that we've got for our 0 to 5-year-olds. Another really exciting launch that's happened in Herefordshire is that when we recommissioned the 0 to 19 public health nursing service, from the consultation that we did with partners, with families, with the service itself, with parents, we realised that there was a real need to introduce a 3-year preschool check. Now, this hasn't been in existence, and it is not in existence in any other local authority that we're aware of. There are 5 mandated health checks that the Health Visiting Service deliver nationally, and we introduced 2 more. So it's a big ask for our 0 to 19 service. So we've introduced the 3-year check and a 4 to 6 month oral health and weaning check. And again, the 3-year check is really picking up on some of those issues around sleep, around speech and language, which we know is a problem in Herefordshire with regards to our long waiting lists, diet, the sort of drinking cups that the children are still drinking from, behaviour, whether they're registered with a dentist. So this is a check to really try and get the children in a better place for when they start school. But in Herefordshire, we're not looking at children being school ready. We're looking at the nurseries and the settings being ready for the children. Because obviously every child is an individual and their development will vary for each individual. So rather than, the very familiar term that we used to, children being school ready, we're changing that focus with our early years education team partners and looking at schools and nurseries being ready for the children. Because as we know, there's been some significant challenges with some cohorts of children, especially since COVID, with regards to their capabilities once they hit school at 4 and what they can and can't do and their expectations of what they're supposed to do at a certain age. So that's a really interesting, and it's been very well taken up by parents, because obviously it's a new health check, and it's the final health check that they'll have at 3. The previous one would have been 2.5, which is a mandated health check. So it's a really good follow-up 6 to 12 months later, with regards to where they are in relation to really now starting the next level of their journey into school. The 0 to 19 service also is operating at a much more integrated level with our PCNs. So we're really bringing the children and families focus into PCN meetings now, where they're represented by a school nurse or a health visitor, whereas previously it was very much adult focused. So we're trying to really change the landscape in Herefordshire. So because obviously health and wellbeing isn't just about adults, it's about the parents and it's about the children as well. So we're really trying to raise the profile of that in our PCN areas. We've got some good work across the local maternity services system that feed into this plan with regards to supporting perinatal parents, parents that have obviously had babies early, etc., and giving them a really good experience in how they are managed and looked after, or if the children are premature. So there's a lot of really good work there as well that leads into that Lindsay touched on with our midwives around breastfeeding data that we're obviously green on at the moment, and we continue to hope that we continue to do that. And also, I think I mentioned at the last meeting we had that the midwives have rolled out across their service the challenging conversations training, because you'd be surprised that even if you are a health professional by trade, the challenges that people sometimes still have in having those conversations with parents, if they are perhaps of an unhealthy weight, or perhaps they smoke or they drink. So it's giving them the confidence to have those conversations that will really impact on their health and their children's health in the long run. So that's just a snapshot. I could go on and on, but that's just a snapshot of some of the really good work that's been carried out on the ground, just to give you a bit of a flavour. Thank you.
Before I call on members of the board for questions, just a couple of points I wanted to raise. The issue of vaccinations for children in care. Obviously, as corporate parents within council, we have an obligation to those children. Can you explain to me why we have a significant level of children in care that do not appear to have been having their vaccinations?
Thank you, Chair. I'll answer this, and if Mohammed wants to add anything, I'd ask him to do so, because he's going to be leading on this piece of work. Excuse me. I think the numbers of children in care who haven't got a vaccination is around 45. And of those, what we don't know for sure until we find the children is whether they're missing one vaccination out of the whole schedule of childhood immunisations that are needed, or whether they're missing all of them or most of them. Many of the children, I think only about 5 or 6 of the children are within Herefordshire, the rest are out of county. So there are kind of issues about ensuring that we are working with some of our local neighbours to get the vaccinations for our children that just aren't in the county. And I think there is also another issue around consent in terms of the children to the age of understanding, whether they are actually in residential care, whether they're in foster care. But Mohammed is leading on a piece of work to look at this in more depth and to actually make sure that, as you say, from a corporate parenting point of view, all of our looked after children have full immunisation status.
Just to add that in Herefordshire, our figures are not that bad. So the figure 45 is 87% of our children in care are fully up to date with their vaccination. It's just as Lindsay mentioned, basically now understanding what are the vaccine that they are missing and liaising with the other local authorities and the other partners to make sure basically that they are vaccinated. And this is a piece of work that we are all working on now, basically, hopefully to try to get them all vaccinated. And also to try to make some improvement in the process of how to record their vaccination status and the barriers on Mosaic, because for now we don't have enough understanding on why some of them are not vaccinated. So apart from liaising with the other local authorities, also for those who are here, trying to understand basically if there are any barriers and recording them systematically on the Mosaic IT system. So hopefully we can provide more updates in the next one, in the next meeting.
Jane.
Yeah, afternoon, everybody. Sorry I can't be with you this afternoon. On that same point, I think also what we need to look at is our performance in Herefordshire has really improved, particularly on that children in care immunisations, has really improved from 80% to 87% since the beginning of the strategy. And all of those immunisation figures, whilst they're below the 95%, that we'd ideally want to deliver, they're all significantly above the regional and the England average as well. So this is actually a good news story. It's one that's improving, although clearly we're ambitious to make sure that we get to the 95%, but there's been some really good work done.
Thank you, Jane. Mohammed?
Yeah, just to emphasize what Jane has mentioned, basically we are improving, and it's read in the report just because we are below the WHO target of 95%, whereas basically if you compare Herefordshire with other local authorities, even within a region, we are doing better. So we are trying to get to the 90% and then hopefully to the 95%. But as Jane mentioned, basically there has been a lot of improvement. Yeah, thanks.
Question I wanted to ask was on regarding the Ambition 3, which was the co-produce a community offer that will extend children's social experience support and their communication skills, etc. And it's amber. There's nothing in the action targets. It just says to be confirmed. And there's nothing in the progress section, including progress and risks. And I'm just wondering, should that not be read? I mean, I accept that the review date is September, but there doesn't appear to be anything done about it at all.
Oh, okay.
You with me?
Apologies. So this is the work with our partners, Talk Community. The reason why it's amber is because of the changes in regards to Talk Community and their shift over into public health. Some of the original targets that were put in this for Talk Community to deliver on, they weren't in a position to deliver on them. So we have changed and adapted some of the targets. So for example, there's going to be a programme of training that will go out to enable some of our partners in our communities to be able to better support a Talk Community toolkit for development in hubs in relation to guidance, training resources around any parents or even young children that might want access to certain information. So that work is on its way. It's just at the moment amber rated.
Too early for a target.
Does that explain it?
You've explained to me what's happening. I'm still confused as to why it's amber and not red.
I think it's amber because the work is underway. It's not that it hasn't started.
So should there not have been something in the progress column?
Quite possibly, yes.
Okay, thank you.
Thank you.
Anybody else got any questions they'd like to ask? Steve?
When you say community partners, is that members of the voluntary sector? Is that what CVS, the acronym, is?
Yes, it's Talk Community and all the work that Talk Community have on the ground with schools, parish councils, etc., and third sector providers. So it covers a broad range of charitable, non-charitable, third sector organisations.
It might be useful just to, in terms of recognising the contribution from the voluntary sector, that if they're not necessarily named, I don't want the report to come War and Peace, but an appendix in terms of who you're working with, just to recognise that the voluntary sector are contributing, because that's lost in here to a certain extent, because they are making a positive contribution, but just not necessarily identified in the paper. Is that?
I think that's a good idea. That's a good recommendation. Anybody else?
Lauren Parry here from Herefordshire General Practice. I was just interested in the data part and to understand what are the barriers to having this dashboard? Why are we struggling? What are the limitations in gathering that data?
There are fewer limitations now than there were probably a year ago. I think that would be the fairest thing to say. So people, right from the start, everybody agrees that a shared dashboard is a good idea. I think it's how it happens, where it happens. The Children and Young People's Partnership Board hasn't actually met for quite a long time, and so I think we felt originally that that would be the appropriate place for all information and data around children and young people. You know, that would be the place for it to go. In the absence of that group meeting, that board meeting, and also reporting to here, we've kind of looked again at the data and thought, well, actually, we can pull this together. Lots of the people around the table, particularly for Best Start in Life, do report to their own organisations. They do collect information for their own services to use. So we have just fairly recently agreed that actually that probably can come off being read, but we want to rewrite it so that it's a different kind of dashboard, and that we're probably going to be looking at double dashboards, if you like. So we've got the proxy indicators dashboard, the local service information, and then we've also got the outcomes framework data that we would want to be looking at as part of our long-term information. Is that okay?
Yeah, it was more a reflection than a question. It's quite helpful when you talk about numbers of people rather than percentages, because we can get lost, can't we, in percentages. So my reflection was on that maternal smoking one. So we've got about 1,500 births in Herefordshire a year. So if that's 7%, that's still over 100 children who have been born to parents or mothers who are smoking at the time of delivery. So I think even though it's good and it's coming down, we really need to be setting our strategy to eradicate it completely, because smoking at the time of delivery, as all the public health professionals will know, it's a real danger to the development of children. So I think we should just continue to push that, eradicating it, and not feel that 7% is a good number.
May I respond? Thank you. It is fantastic figure when you compare to 4 or 5 years ago when it was 14%. So I think that there's an amazing work that's been done there. The national target is for 6%, but you're right, we don't want to rest on our laurels. We need to keep going. We also want to develop a pathway with health visiting service so that we can make sure that mothers who have given up during pregnancy don't start again once the baby's born. And I think the same is true really for our children starting school at reception. It looks like the trend might, hopefully, fingers crossed, be starting to go down, but actually we still don't want to be complacent about being close to the England average for overweight children starting school. So we need to keep being ambitious, I agree.
Yeah, absolutely. I'm not criticising at all. I'm just saying that as a board, we need to continue to push to eradicate it. And I think the other thing that's worth reflecting on this one is the last time I looked at this data, about the rate of smoking at the time of conception was about 25%. So the work we've done from conception to birth with mothers is excellent. If we're going from 24% down to 6%. But the other thing that's most worrying is the relationship between IMD profiles and smoking status at the time of conception and birth. So we can be really targeted on how we go after this, and I think it's important that we do stay true to the data, focus on where the problems are, and maintain our ambition to be the best in the country at this.
And I mean, I've raised this with Lindsay before, that I think the figures are good, but we shouldn't be complacent. But we really do need to look at what happens 4, 5, 6 months after the baby's been born, when I know from members of my own family that they then return to smoking, and it's probably a time when mothers are most anxious. And of course, it's not just the mother smoking, it's taking that baby back into a family where possibly the father and other members of the family are smoking as well, and working with the whole family to try to stop them from smoking if they can, or reduce the level of smoking. So I think that's an important issue that we need to be looking at going forward. Does anybody else have any questions? No? I mean, we are going to go on to the tobacco control plan shortly, so we will hear about the work that we are doing with people who, at the present moment in time, are still smoking. So I'll go back then to the recommendations which we have, which is the board considers the report and appendices and notes the progress and challenges to date on the best start in life priority. And Ben, the added recommendation.
Yes, Chair, is regarding that feature reports on best start in life sheet priority, including appendix to detail the stakeholders, particularly voluntary and community sector contacts being consulted.
Yeah, and those that are involved with any of the projects that we're involved with. Thank you. So can I have a proposer that we accept this report? Hilary. Seconder? David. All those in favour? Thank you. We now move on to item 8, which very timely is the tobacco control plan. The purpose of this report is to update the Health and Wellbeing Board on the actions taken to work towards achieving a smoke-free generation in Herefordshire, including the new Tobacco Control Alliance, and request sign-off from the board on the new tobacco control plan. This is going to be introduced, and there will be some slides, by Harpal, with contributions from Luke, Bennett and Isabel Adams. Thank you.
Thank you, Chair. So my name is Harpal Odula, and I'm one of the public health consultants in the team, and I'm just going to do a short introduction before I hand over to Luke on the plan. So what we're presenting here today is a look at the new tobacco control plan, which comes from national funding from to achieve a smoke-free generation in Herefordshire, which means 5% or below prevalence in smoking. Right now we're at 10.1, so halving that essentially. We want to present the plan, but also give you a bit of an idea around the alliance and stakeholder partnership working that we're doing as well. And it also sets out our future plans as well of how we can update the board as well. So I'll hand over to Luke now.
Thank you, Harpal. Good afternoon, everyone. Luke Bennett, Public Health Lead for Health Behaviours. So just following on from what Harpal said there. So from the National Tobacco Control Plan, which was launched last year, in Herefordshire, we actually pulled together a Tobacco Control Alliance, which was formed in 2024. And that was made up of a load of partners from fire service through to environmental health trading standards, as well as council officers, health colleagues as well. And that alliance has worked together to pull together a 5-year tobacco control plan, identifying some of the issues that David raised earlier around inequalities in smoking prevalence, to pulled together a range of actions to work towards those. So the purpose of the tobacco control plan is to work towards 5% prevalence or below, in line with the national objectives. As Harpel stated, the current smoking prevalence in Herefordshire is 10.1%, which equates to around 16,000 people. But we do have inequalities associated with that, which I'll go into a little bit later. Smoking still remains leading cause of illness, premature death, and differences in life expectancy in Herefordshire as well. So obviously the priority to do something about it there is vital. And the tobacco control plan supports the following strategies. So our health and wellbeing strategy, Herefordshire Council plan, ICS health and wellbeing, and the NHS long-term plan as well. So in terms of the tobacco control plan and the alliance, the expected impact is that obviously it will play a key role in tackling inequalities. There's also the financial impact that benefits people and obviously the health and care system as well around reducing smoking prevalence. And you can see there the costs of smoking to the economy, to people, is estimated to be 123 million per year. In terms of some of the health inequalities in Herefordshire around smoking prevalence, so it's estimated that 20% of regional manual workers smoke. There's also 27.8% for people with long-term mental health conditions. We mentioned earlier about smoking at time of delivery, and obviously it's proposed that it's come down from that 8.3% from the data we have. And then also in areas of higher deprivation, there's higher prevalence as well. So we also expect that the Alliance will provide a good opportunity to work together to tackle some of these issues, and the plan sets out how we will do some of that. So the tobacco control plan itself has 4 main work streams, which again aligns to the national tobacco control plan. So around prevention, supporting smokers to quit, eliminating the variations in smoking rates, and then also the effective enforcement. So a real sort of broad range, not just focusing necessarily on supporting people to stop, but also the wider sort of environmental factors as well that smoking causes. So an example of some of the actions that are included in the action plan, so are in the slide here. So we are also including vaping in the conversation as well, so around tackling youth vaping. And as you can see here, some of the prevention activities will include things like smoke-free spaces as well. We've had various initiatives in Herefordshire to support that, and the plan sets out some of those things. Also supporting smokers to quit, so increasing referrals into stop smoking services, providing brief advice training to partner organisations and services, introducing smoke-free champions and delivering comms campaigns as well. In terms of then eliminating the variations in smoking rates, we want to sort of target and provide more support for those target population groups, understanding the needs of our smoking population as well, and introducing more sort of community initiatives too. And then we've got effective enforcement there to tackle things like illegal and illicit tobacco as well. So all that's detailed in the action plan, which should be attached to documents. So then in terms of, okay, how do we know about the impact the plan is making? We've in the process developing a dashboard which will sit with the Tobacco Control Alliance around some of these key measurements set out in the slide there. and we expect to provide progress on the actions to the Tobacco Control Alliance on a quarterly basis, and hope to report annually, which is one of the asks, to the Health and Wellbeing Board on an update of those actions and those measurements. So the recommendations are that the Health and Wellbeing Board supports the Tobacco Control Plan and supports the actions that have been developed to deliver on those priorities, and then also to support welcome an annual update from the Tobacco Control Alliance on progress against those action plan and those priorities.
Isabel, did you want to add anything?
Thank you. I will do, yeah, briefly. I just wanted to say that when you look at the appendices, obviously there are a couple of points that still say TBC, and that's because we are about to have our next quarterly Alliance meeting on the 24th, where we expect to kind of do a deep dive into some of these actions that were developed at a workshop back in December. And at that point, we'll be able to fully detail the rest of the plan, kind of assigning responsible services and also working with partners to identify any other indicators or data sources that we can be using that will feed into the plan and that will kind of back up what it is we're doing and illustrate progress made against all of the added actions, essentially. So, yeah, we're very nearly there. Thank you.
To members of the board, just a comment to make with regards to smoke-free spaces. I had the pleasure of going along with Isabel, who can be quite formidable when she wants to be, to a sidelines event, which was an event with local football clubs in Hereford City. That mainly the youngsters were for between the ages of about 5 and 12, weren't they? And the idea was that if we saw any adult standing on the sidelines smoking a cigarette, that we approached them carefully, although, as I say, Isabel can be quite formidable, and reminded them that it was probably not a good thing to be smoking particularly at a sporting event, but in front of your own child or children of people that were also there. It was remarkable how quickly they stubbed those cigarettes out, and we didn't see them smoke again at that particular event. But it was a really good opportunity. But I have to say, to be fair, there were quite a lot of men and women there, and I think we only actually found 2 that were actually smoking on the sidelines. So that, I think, was a good example where people either were making the choice not to do so at that particular event, or just do not any longer smoke. Thank you. David.
You put some numbers up about 8% of secondary age children vaping and 21% at sixth form, basically. Are we doing enough with those institutions for them to promote the dangers, the risks, what work are we doing with those institutions, given that's quite a noticeable increase, isn't it, from leaving secondary school to going to sixth form and then taking up a habit that we ideally wouldn't want people to start taking up as an alternative to smoking and tobacco. Good, but we wouldn't want people to start vaping if they weren't doing anything at all.
I'll answer that. So there has been some work. There was some work, I think, at one point through our Healthy Schools programme, and there was an arts-based project that was an engagement piece, essentially, with groups of students. I think it was at the Art College. My colleagues will be able to confirm. And to sort of raise awareness of the dangers around vaping, and there has been some work in that area, including posters, sort of advertising the dangers and things like that. But I think you're right. I think there is more that can be done. I know that, as my colleague mentioned, the Healthy Schools programme is expanding more into the sort of further education sphere. So actually, I'm hoping that we're going to be able to work quite closely with that. And a lot of that detailing will come in, as I said, at the next Alliance meeting next Monday. But yeah, I agree. There's a lot more that could be done. Yeah, and I think we will get the engagement as well, because there was a lot of positive engagement from the last project that was undertaken. So I'm feeling optimistic about it.
To make another comment about the vaping, you obviously are going into secondary schools. It is pretty clear that now this is a problem that is migrating down to primary school level as well. And so we've got 10-year-olds that are vaping. David quite rightly said that as we believe at this moment in time, vaping is not as dangerous or as bad as smoking. But we really do not know what the impact on vaping is, as we didn't know what the impact on smoking was 50, 60, 70 years ago. And so I think my concern is, and I think everybody else's concern is, that we're building a generation of people who may never have smoked, but because vaping is seen as quite cool, there are flavours, there are all sorts of things, that we are actually getting people at a very, very young age taking up vaping who probably would never have smoked a cigarette. And then we do not know, because we haven't got enough data yet, whether they then migrate on to smoking as they get older because of the nicotine dependency that they acquire. And that is what worries me. As somebody personally impacted upon being a heavy smoker at a young age, being unaware of the damage, I am really frightened for the generation that is coming through now.
Yeah, I would echo that, and I think that the swap to stop has had a direct impact on teenagers who, as you said, were a generation who probably never would have smoked cigarettes, or very few. I just wonder how much we're doing. I mean, that we have an extraordinary number of vape shops in Hereford, and they are, shiny, colourful in a way that you can't buy cigarettes like that. Is there anything that we can do to do something different about that? Because that is the accessibility that you have for all of the sixth formers wandering around town, isn't it?
One of our alliance partners is Trading Standards, and they are working tirelessly, and have been doing, regardless of the beginning of this plan, to stop underage sales and undertaking test purchases and things like that at these shops, to ensure that essentially there are closure orders, etc., if underage sales are being made. Packaging is a real problem because it looks attractive to young people, but that is something that's we are hoping will be addressed as the Tobacco and Vapes Bill progresses. We know that as of June this year, there won't be any more disposable vapes, and I know that's the most popular product with young people, so we're hoping that will make a real difference. We are also, I meant to mention earlier, part of the plan will be working with our Trading Standards colleagues to work with schools as well as partners to get an understanding of geographically where the real sort of problem areas are for underage sales and things like that, so that we can target our actions essentially geographically, but also, as you mentioned, Councillor Andy, it will be with primary schools as well as secondary schools. Hopefully that answers your question a bit. Thank you.
Did I just see your hand, Christine? Christine?
I was just going to say we couldn't hear you then for a minute.
Oh.
No sound.
Chair, just don't think you had your microphone on. I put it on for you.
Oh, thank you. Gosh, damn it, ever said they couldn't hear me. So the recommendations, they did come up on the screen, but they are in the report. So they are that the Health and Wellbeing Board support the new tobacco control plan for Herefordshire and the roadmap to achieve a smoke-free Herefordshire by 2030. The Health and Wellbeing Board supports actions to deliver on the smoke-free Herefordshire 2030 strategic priorities, including building strong place-based partnerships to achieve our smoke-free ambition, and the Health and Wellbeing Board welcome an annual report from the Tobacco Control Alliance on progress against the planned actions of the Tobacco Control Plan. Do I have a proposer for that? David? Seconder? Okay. All in favour? Thank you. We now move on to item 9, which is an update to the board on the implementation.
How we present that. So we're showcasing some of the things that are happening on the ground, the real work happening, and we're looking the real work happening, and we're looking really forward to this sort of format, and hopefully can do more in the future like this. I'll hand over to Luke now.
Thanks, Harpal. Yep, so the core aim of the Herefordshire Physical Activity Strategy was to improve health and wellbeing of residents by increasing physical activity, and that through opportunity and accessibility of activity to reduce inequalities as well. So the strategy has 4 shared outcomes, and like Harpal says, it was developed in 2022-2023, and the 4 shared outcomes were active environments, active communities, healthy individuals, and partnerships and collaborative working. And that's the strategy, and the action plan sits with a physical activity steering group, where partners across the system work to that action plan to deliver on those shared ambitions. In Herefordshire, physical inactivity, is one of the leading risk factors for non-communicable disease, and people who are inactive are 20 to 30% more likely to of death compared to people who are physically active. So physical activity levels in Herefordshire have been increasing over time. So we can see that in 2015-2016, in the graph on the slide there, it was 59% of people were active, whereas in 22-23, it's 66% of the population were active. So as we can see, there's been progress has been made in terms of physical activity levels. However, although physical activity levels are increasing, there is still a quarter of our community who are inactive. And obviously I've just mentioned the consequences of that. More sort of alarmingly, over the age of 75, there is a higher level of inactivity in Herefordshire compared to the national average. So 58% compared to 45%. And then just to outline those needs around children and young people as well. So although again, physical activity levels are good compared to the national average in terms of Herefordshire, for children and young people, we still have 28% of that population group who are classed as inactive. So less than 30 minutes of activity per day. So in terms of the highlights of the physical activity strategy and the action plan and some of the things that have been delivered, we just wanted to give an update around some of the things that have been happening and that will be happening over the next year, and next steps around those, but just wanted to have a bit of a spotlight on some of these activities that have happened sort of over the last year or two. So as you can see, I'm not going to run through them all because we are fortunate to have some of the providers in the room today who are going to give a lot more detail and kind of the insights around those. So I'll just hone in on number 3, which was Street Tag, which was an interactive app which we co-funded with Active Herefordshire and Worcestershire to increase activity levels in families and children and young people as well. And that's been trialled in the last year and shown good engagement and good increase in terms of physical activity in the reports attached to the documents circulated today. And then I'm going to pass over to our first spotlight provider, which is for Halo Leisure. And as you can see, they are sporting their award that this programme won earlier in last year. But I won't take any more of a limelight from them, and they can sort of talk a bit more in detail around the programme.
Hi, my name is Aneka, and I'm here with my colleagues Mark and Ryan from Halo Leisure. We run the Feel Good for Life program. We do several other programs as well, but this one is probably one of our hallmark programs. It started off in Wales, in Bridgend County, and we serve people who are living with dementia, but are also experiencing isolation, depression, other complex health needs, and as well as their carers to become more physically active and resilient. So this program, sorry, next slide. This program takes place weekly and is a combination of physical activity and social entertainment kind of activity. So usually each session will include low-impact physical activity in the form of resistance bands, like you can see here, or it can include time in the toning suite or guided exercises by an instructor. In Leominster here, we do a swimming session. We also include tea, biscuits, that kind of thing, and a chance for people to connect with each other and chat with each other. We do social activities like quizzes and sing-alongs. Mark's really great at coming up with all sorts of activities for the groups to do. We do quite a lot of signposting and connecting people to different kinds of supports in the community that they live in. So falls prevention, fire safety, all sorts of stuff. It depends every week. So it's quite a holistic approach to well-being for people who are in the session. The sessions in Herefordshire launched in November 2023 in Hereford, and then in Leominster in October 2024. And we provide free transportation for anybody who has mobility issues or is not able to drive anymore. Next slide, please. So our original project goals were to serve 40 older people with long-term health needs, as well as their carers, through our programs, to make one community leisure environment accessible, and to help participants lead more active lifestyles. So this is connecting them to supports, connecting them to each other, leading them through exercises and different kinds of activities that kind of help them become more resilient and improve their overall quality of life. We take kind of an overarching holistic approach to this as well. We try to make sure that anybody who is coming into contact with our participants has some sort of training around disabilities and dementia, so that people are not put off every time they come into a leisure centre or they come into a program. So this includes all our staff and our volunteers. Next slide, please. So in terms of training and support, we all of our staff and volunteers go through a dementia e-learning module as part of their induction. We also we do an additional Dementia Friends training program that's provided by the Alzheimer's Society as with all of our volunteers. So this is additional support for people who are working with our participants. Next slide, please. In terms of making the environments more accessible, so this includes big and small adjustments. We make sure that the lifts are available for people who have mobility issues. We look at stuff like putting covers on the mirrors in bathrooms for people who are living with dementia and get a little bit, can be a little bit disoriented by seeing their images in the mirrors. We have sturdy chairs, we've got dedicated signage. As I mentioned, we also have the transport service for people, and we also have a volunteer befriender driver program to help people get to and from the sessions. Next slide. I'm just going to give you a really quick rundown of our KPIs, but I think Luke has circulated a longer report with some of our outcomes. So the average age of our participants is 76 years old. 79% live with dementia, 74% with a disability, 89% have a long-term medical condition that affects their day-to-day life. So it's a range of people who are experiencing lots of barriers to physical and social activity. A lot of our participants say they live with loneliness, depression. We've got people who are living with CPTSD, lots of other kinds of things like that. Around a quarter of participants are completely inactive at intake. The way that we measure this is that we ask participants to self-assess at registration whether they engage in 30 minutes or more of physical activity, and we define what kind of physical activity that is in a week. And so 25% of those, 22% of people say that they don't do anything. At 6 months, 100% are saying they're active for at least 30 minutes or more per week, and on average, our participants are doing about 2 30-minute sessions per week at that point. We also serve 26 unpaid carers, so these are people who attend the sessions along with the people that they care for, and have a chance to kind of connect with each other and chat with each other about what's happening in their lives and share best practices and stories and stuff like that. Next slide, please. In terms of well-being, so we use a WHO methodology to ask people to self-assess how they feel about their physical health, mental, emotional health, their confidence to take part in activities, their connection to supports, and their awareness of entitlements and supports. So you can see that there is an increase over time, from time of registration to 6 months. So we do surveys every 3 months in the first year and then every 6 months after that. And you can see like the most dramatic increases here are in terms of confidence to take part, and also just awareness of what's available in their communities, and also that kind of willingness to engage a bit more with their communities. When we ask them what kind of stuff they enjoy most, is meeting other people who are going through the same kinds of things that they're going through, access to the toning suite, which is pretty cool, and the friendships that they make. So for example, last week there wasn't a session, but several people from the group actually got together outside of the session and met for coffee. So it is a really nice community that Mark has created here. It's people who live in the same area, who are experiencing very similar kinds of issues in their lives, and form quite close friendships. Also, the volunteers and staff just do a fantastic job, so everyone in that group is quite nice. Next slide, please. So this is us with our award in Manchester. You can see this is a really, really nice, flattering selfie that we've taken. We work really closely with local partners, so we work with Dementia Matters here. We've had some art therapy sessions, falls prevention, therapy dogs, all sorts of stuff. We are very open to working with anybody who might want to speak with this target group. So they come in every week. They're pretty engaged. Mark is great at setting up outside speakers. So the more the merrier, essentially, if people want to come and speak to this group or kind of lead any kind of activities, we're very open to that. Next slide, please. So I'll pass it over to Mark, who runs the program here, to talk about one particular couple that comes to the program.
Good afternoon, everybody. My name is Mark Farrell. I'm the Active Communities Coordinator for Herefordshire, and I run 2 sessions, as Annika says, in Hereford and in Leominster. On the screen is the lovely Rika and Colin. I assure you, Colin has a resting dad face just like me. I can assure you Colin is smiling because Rika's smiling, and therefore I know Colin is smiling. So they come along to the session at Hereford on a Thursday. Colin suffers with depression, anxiety, and as much as helping him along his journey, we're also helping Rika along with the journey as well, because he always needs to be within a couple of feet of her, and therefore what we've allowed them to do is have a little bit of time separated from each other at the session, which is covered off by the volunteers and people like myself. Colin there, as you see, his mental health wasn't particularly good. He's rated that as an increase, and also his physical health wasn't particularly good. What he started doing now, whilst he comes in on a frame, walking with a frame, he uses the lift to go upstairs on the first floor foyer. But at the end of the session, he's assisted down the stairs without his frame, and that is part of his challenge. That's been an improvement since we started. Whilst on occasions he doesn't take that opportunity because he's not feeling so well, he's always in the toning suite using the machines, and therefore he's getting his general dose of activity during that session. I will say though, please do not stand between Colin and a plate of jammy Dodgers, otherwise you're going to get run over very quickly. Within that session then, Colin is ex-Fleet Air Arm as well, so we've got a big military population in our city. I'm ex-Air Force myself, so there's obviously a certain amount of banter that goes on between the two of us, but also that allows him to speak about his times when he served as well. And I always take a couple of minutes to sit with him and chat about different projects that we've been involved in our military careers. In addition to that, just quickly, quick update for a gentleman called Will. He worked for Wiggins at the top end of town there. He came in to the sessions. He wouldn't look at anybody in the eye at all when he came in. But now what he does, he is dropped at the front door. He's straight out of his car, straight into the session. And the other week he met two of his ex-colleagues at the top of the stairs and had a 5-minute conversation with him. That would never, ever, ever have happened without him being exposed to this type of supportive environment that we've got for our customers. In addition to that, unfortunately over Christmas, his wife passed away, and so now our sessions are even more of a pillar for him to come to on a Thursday. I spoke with his daughter last week, Heather, and she said that if it wasn't for the Thursday session, then they wouldn't know what to do for him, because he is in such a, or was in such a poor state with the passing of his wife. So hopefully we'll continue to come, but that just shows you a little bit of an effect of what we can have on people coming along, give them a safe, supportive environment, a bit of chat, smiles. We sing out with Bring Me Sunshine from Morecambe Wise every week, which everyone leaves with a smile on their face. So if you do come along to our session, Councillor Andy, please bring your singing voice with you, because we intend to sing out as well every week. But yes, it's a fantastic session to be involved in. I just want to say that it's an honour and privilege to be involved in something like this, because it has such a massive effect on population in our county. Next slide, please. So just a quick summary then. We have got a session at Leominster. First part is a little bit of swimming to start with, so mobility in water, and then activities and socialisation afterwards. That's on a Tuesday, the first 3 Tuesdays of the month. And then in Hereford, we've got Thursdays, weekly on Thursdays, and that's physical activity, either in one of the squash courts there or in the toning suite. There you've got the registration link there and my name on there as well. We've also got 30 people attending at Hereford every week. We've got a waiting list now of 12 couples at Hereford. We have availability at Leominster at the moment. We've got 9 people attending regularly there, and we can do up to 15 people there, so there's 6 more slots available. But thank you very much for listening this afternoon, and it is a successful project, and we really do appreciate support from all our partners in Herefordshire. Thank you.
Can I just say, Mark, before we move on, that I have booked into my diary to come to the Leominster session on the 15th of April. So I will be there. Fun? I don't know about the singing. I don't think does it mention the singing in the email? I didn't see the singing. I saw the quizzes.
I'll print you a song sheet and send it through, so Luke will pass it
I
on
wish
to you.
you hadn't.
I can come and do a personal rehearsal if you want.
Thank you.
Apologies, I didn't realise Halo and Stride were doing presentations. I should have declared an interest. I'm a trustee at Halo board, and we've funded or fund Stride to do various pieces of work. So a misstep by me. Apologies. I do have a question in terms of the evaluation. In terms of you're obviously making a massive impact, and I appreciate I'm biased when I say that. But the saving to the system. Have you had any attempt at trying to circle that back around? Because obviously you're making a massive impact to these people's lives, but as a consequence, they're no longer or using the system, the clinical side of things, less. Have you, I know that's a really impossible task, but have you had a try at that?
We are actually in the process of doing something like that. So we're using kind of a social return on investment methodology to try to do that. So it's a bit of a long process, but we keep quite good records of what's happening to people as they go through the program. But I also attend sessions and chat with people. We do lots of case studies around that. We speak with people who are referring into the program, so that includes GPs and trusts and mental health teams, all sorts of stuff like that. And then at some point, I'm going to sit down and try to qualify and quantify that value to the different systems. Hopefully that will happen over the next 6 months, so that's something that I am working on.
Can I just come in there and add? Obviously, there are clear links to unpaid carer strategies within this, and clear links to the work that John Burgess is doing within the county as well. And NACA has done those social return on investment calculations on our carers respite provision in other counties, and that's calculated that for every £1 of investment there is £14.69. Yeah. £4.69 of social returns. So absolutely, really important to be able to quantify that difference and answer the "you've done this, but so what" question, and we are very conscious and aware of that and working towards it.
Thank you. Good afternoon. So I'm Becky Williams. I'm the Manager Director of Stride Active. I'm here with my colleague Sarah Volpe, who's our Active Families Coordinator. So we've been asked to talk about a number of projects and programmes that we deliver on, which I will try and get through as quickly as we can. But I'm conscious there are some people in the room that don't know anything about our organisation, so I just wanted to start with talking a little bit about Stride Active and what we do. So we can move to the next slide, please, Luke. Okay, so we engaged in the last academic year 91 schools across the county. That's equivalent to about 87%. We do this with a really small team, so we've got 5 members of staff. I'm the only full-time member of staff in the organisation. The rest are part-time. So you can see the amount of coverage we have across the county with a really small kind of capacity. But we do it, and we do it really, really well. We are school-focused. We're based out of Whitecross School. We're completely independent. We became independent in April 2024, so almost a year old, essentially, of being completely independent. And all of our work is school focused. So we work with children and young people, we work with families, all through Access and then via schools. We use PE, school sport, physical activity, play and movement to make a difference to children's health and wellbeing outcomes. And that is massively varied in terms of what those outcomes are, and we'll pick up on some of those when we go through our different programmes today. The main thing to say, I think, is that we are grounded in young people's voice. So everything we do is led by young people, what they want, what their barriers are, what the challenges are. And we use them to kind of co-produce the work that we do. And again, you'll hopefully see some of that in the examples we're going to talk about today. Next slide. So these are the areas that we've been asked to talk about. So we'll go through Healthy Schools, which we've mentioned already in this meeting. Here Goes Can. We'll look at our confidence and resilience interventions. And Sarah will be able to talk very specifically and bring Active Families to life for you as well. Next slide. So our support around Healthy Schools, so it's a new programme for us to be involved in. And what's really been nice is that we've been able to be involved from the kind of the offset of the programme, which means we can make things easier and more time efficient for schools, knowing the challenges that they face. So one thing that we were able to do was to look at the criteria that's been set by Healthy Schools and match that with the school games mark criteria, which 50 schools achieved their school games mark this year in the county. So that means that without having to do one set of work and then another piece of work, we've been able to bring both together. So by them completing their School Games Mark Award, they're automatically working towards the Healthy Schools. We support very specifically on the physical activity part of the wheel within the Healthy Schools programme, but we're looking at how we can actually use physical activity to support wider outcomes. So whether that's mental wellbeing, whether that's healthy eating, linking to PSHE and RSE as well. So how we can bring that into the wider frame so it's not just as a standalone anymore. Actually, schools are understanding the difference it can have in terms of much wider outcomes. So our work around this is around bespoke support to schools, developing resources and opportunities for schools to actually enhance the work they're doing around physical activity and raising the profile of it throughout the whole school. We're working across nursery settings, primary school settings, and both Lindsay and Julie mentioned around secondary schools earlier as well. So we're actually starting to look at through our links with secondary schools, identifying which schools want to be involved in a pilot so we can understand how they want the Healthy Schools programme to work for them. So again, it's all around being bespoke, understanding their needs and working with them to make sure we're developing a programme that's right and that works for them. And again, through our links, we've been able to identify different schools that we can bring into the programme because we've been able to kind of amplify the links that we have with different pastoral and PE coordinators within the school and nursery settings. Next slide, please. So Here Girls Can is a project that we deliver in partnership with Active Herefordshire and Worcestershire. We've delivered it in its current format since 2022. And I think the first slide I spoke to you about in terms of young people's voice, it's been designed by girls for girls. So we carried out a number of focus groups to begin with. We really understood what the barriers and what the challenges were for girls, and we continue to do that through the programme. And we designed a festival based around that. On paper, it's a one-day event, but actually the impact we're having from it is now proven to be long-term, and we're seeing impact 3 years on from the programme now, which is really positive. So since we started, we've engaged 47 schools across the county. Schools have to apply to be part of this programme. The demand is so high for it that we actually have to put applications out and schools apply to be part of it. We've engaged 500 participants, and I would say that 95% of those are unique participants as well. And we've trained 88 girls champions. So they are older girls from secondary schools who support the festival and who also then go and continue their work and their training and embed it back into their own secondary school environments as well. And you can see the photo there of one of the girls champions supporting one of the participants. That was in our February festival, so just last month. We have enormous amounts of feedback, and I think that the latest impact report has been shared with the group. But I just wanted to put one quote on the slide just there because I think that really shows the difference that this programme's making to young people. That quote was completely unprompted. We just said to young people, just give us your thoughts, give us your feedback, tell us what you thought about the event. And that's what came out completely unprompted. We want to bring it to life a little bit more again. So we've actually got a video to play to you. So this video is in first draft form. Nobody has seen it yet, so you are the very first to see it. It will have a little bit more work over the next couple of weeks before we kind of release it publicly, but it really brings to life the impact that the programme's had over the last 3 years. No, you're good. Cut me off, you're good.
Welcome to Here Girls Can. Come and find out what it's all about.
Since attending the Here Girls Can festival last time, I have noticed a huge difference with the girls. They have participated in sports more happily and openly. They've been a lot more resilient as well to give things a go and shown a bigger willingness to try. They've also embraced the girl talk as well and just been a lot more open to talking about things that might be playing on their mind or worrying them, which has been lovely to see.
When I was in year 7, I came here and I felt quite alone and I wasn't very active in PE, but the Here Girls Can made me feel really welcomed and they helped me get involved in the activities. Coming back now as a Here Girls champion makes me feel very happy because it means that I can make all the other children feel welcomed and get them involved in the activities so they don't feel left out.
As Girl Champions, we've been helping out young girls take part in aerial hoop. Because of helping these girls with aerial hoop, we've actually found that we've really enjoyed it, and so because of that, we're going to join the community class.
Being part of Here Girls Can has been absolutely amazing to work with. It's been not only just impactful and beneficial for Pure Studios, but for all the organisations in the Foley Estate area as well. It's been amazing watching these girls come back to our regular kids classes and have been growing each week.
Previous Girls Champions have introduced a trampolining club through our school as a result of coming to Here Girls Can. Something else that we've introduced to our school after attending Here Girls Can is period products in our changing rooms, as requested by some of the students that attended.
The Here Girls Can has been a huge catalyst for changes in attitudes and participation rates at our school, and I'm sure across the whole of the county. Before the campaign, the numbers were quite different between the boys and the girls' participation rates at school, but now I don't see any difference at all, and I think Here Girls Can has really been the facilitator in this change.
As a community provider, we support Here Girls Can because it's such an important flagship project to bring girls into a space where they can feel safe, they can move, they can discover their own bodies, where they don't feel judged, and that then they can take those feelings of empowerment and of confidence back into their daily lives. It also fits so well with our own values as a community organisation.
Engage with Here Girls Can and be a part of the change.
Thank you. So hopefully that kind of spoke more than what I could have said about the impact that it's had on the schools and the young people that have been part of the project so far. I'm going to move on to talking about our confidence and resilience interventions next. Next slide, please, Luke. So we've run these for a number of years, and we run these typically during Children's Mental Health Week. And we use physical activity to support wider outcomes, so kickboxing and karate for confidence, climbing for confidence, and roller for resilience. And I've just put some stats on the slide in terms of the difference that young people feel that they've experienced as a result of being part of the interventions. I've just got one story to tell you that kind of really stands out with roller for resilience. This was, I think, 2 years ago maybe. We had a young person called Gracie come along to the session. She was year 6, very tearful when she got there, very apprehensive, felt very overwhelmed. Bear in mind, we only had 15 in the group, so it's very small numbers. She'd never skated before. She really struggled to get up on the skates. She struggled to move on them initially. Went through a lot of work with her throughout that session. And by the end of it, she was not only up and skating, she was throwing a ball around and she was dancing. And then I heard back from the teacher about a week later, and she said that Gracie really struggled with anxiety, and particularly since COVID, Gracie wanted to use hand gel at every single opportunity. So the fact that she came along and put on equipment, hats, pads that had been shared by lots of young people that, you know, was definitely very sweaty. And she wore it, she took part, and the teacher said she got back in the car after the session and she didn't ask for any hand gel. And just a moment like that, you know, it shows the difference it's making, but it's very different impacts for different young people depending on what their situations are. And we try to treat every young person as an individual and accept that they're all there for very different reasons. But we ask the teachers to pick the young people that they feel would benefit most from the intervention. So it is really, really targeted So this one in particular is all around, like I say, building resilience and confidence, which we know is very significant since COVID, and we're hearing more and more from schools that that is absolutely what's needed, and so we're using physical activity a lot more to try and achieve some of those outcomes. Next slide, please. So I'm going to hand over to Sarah now to talk about active families.
Hi, I'm Sarah from Stride Active, and I look after the Active Families project. There are three main strands to Active Families. The intervention itself, which is a one-to-one person-centred support intervention for a minimum of 12 weeks. We work with families who are less active that would like to be active. So far we've engaged with 23 schools across the county, working in schools and with schools to support their families. Relationships are key to active families. The relationship with the family themselves, really listening to their wants and needs and their reasons for not currently being active are really important to supporting them. Schools working with key members of staff, especially pastoral leads, head teachers, looking at those families who are most at need within that school, and also having the ability for the schools to signpost families into active families as well. Physical activity providers are also part of the relationships. Working with them, looking at affordable rates so families can access physical activity, and helping to make families aware of what's available, from us actually finding out what is available out there for families. We can work with families as in the whole family, individuals within the family, so it could be one child out of three, it can be the whole family, it could be the adults or also the children as well. So it can be any member within that family who could be looking to source physical activity opportunities in the community or at home and around the home. The bag is the third element, and there's so much I can say about that, but I know I've only got a small amount of time. I have actually brought a bag with me, or two actually, so do feel free to come up and have a look at some of the paper-based games and activities that we give families, which will help you to see what is available. They are fun, simple, play-based games and activities that can provide instant activity. It's a grab-and-go bag, anywhere activity. It can be for 5 minutes, right through to hours of play at the weekend or in the holidays. It really has provided a stepping stone to empower families to become more active and find more confidence in being active also. Could I have the next slide, please, Luke? So this slide shows the impact on physical activity for the families from active families. The green areas show the level of physical activity, and we go from baseline to the 12-week point in the intervention to follow-up. By working with the families and listening to their wants and needs and providing activity ideas for them, it's helping them to become active in a way that suits their family, their dynamic, their finances, and what they want. So figure 1 shows the activity levels for adults and shows the increase from baseline right through to follow-up, and figure 2 at the bottom shows the activity levels there for the children. Next slide, please. Our active family outcomes form 5 main themes. The increase in physical activity we've just seen from the previous slide, and that's taken place in many ways. For some families it can purely be just using the bag and the activities. For others it can be ways they found of embedding physical activity into their daily life, finding more family time together, actually allocating time at weekends to go out together on a Saturday or a Sunday, having that family active time. It can be accessing community activity. There's a whole range of different ways that families have been able to increase their physical activity, and also simply not using the car and walking to school, walking to the shops. Simple steps, small steps that's helped them increase that physical activity. Also, there's the feeling that they have more knowledge of what's going on locally by giving them information of crash course swimming lessons, looking at affordable rates with various providers. They feel that they have more tools now to work with and ways to become active that maybe they wouldn't have done before because A, they didn't know about it, and B, financially they couldn't because they didn't have those accessible rates available to them. The third one is benefits of play. Many parents have commented on how much they have enjoyed playing again, playing games like hopscotch with their children, going out and playing games that they remember when they were younger, has really encouraged whole families to come together and all generations of families. Parents have also commented on really enjoying seeing the joy that being out and playing brings, and also how it's distracted from tech and devices in the house, which is one of the common things that parents ask for is, I want something to get my family active, get the children away from tech, get them out of their bedrooms and off the devices. The fourth theme is the positive social impacts. Many parents comment on feeling more connected as a family, feeling that their children are more confident to go out and play. They're now playing with friends and neighbours, so there's that element of socialisation, and they feel closer as a family. And the last thing, health and wellness. Many families do comment on feeling fitter, healthier within the family, looking at other lifestyle behaviour changes as well. A lot of families say that anxiety has been reduced, that mental health has been improved. One example I can give is one of the resources that we created is a walk to school pack, which you're welcome to come and have a little look at. We've used that with children who've had anxiety about going to school. So that has helped some children, enabled them to have a distraction tool that they can use to support that journey to school, just to divert their minds, to help them get into school. Next slide, please, Luke. And lastly, it was very hard to pin it down to one, but I managed to just do one case study from a family, just to sort of give you an idea of a journey. So this family was signposted by the pastoral team at their school. Mum initially just requested activity for the family. For her children, sorry. She wanted the children to get off their devices, come out of their bedrooms, and get out more. But she wanted activity that was easy to do, and it had to be low cost because cost was a barrier. She also recognised that because of her own injury, that the children weren't getting out and doing more. She couldn't go out with them because she had this injury, which meant that she couldn't walk very far. So the family were given a bag, a range of paper-based activities to play indoors and out. At the 12-week point, Mum said they love it. They're using the bag 3 times a week for 30 minutes, and they're making up their own games, and even Mum made up a game to help the children learn their times tables. So she'd adapted one of the games so that she could help them learn their times tables as well. At 6 months, Mum commented that the bag has helped them to want to go out and play, and I think that is key. It's having that change in behaviour from wanting to go up to their bedrooms, wanting to sit on their phone or using a device. The children now want to go out and play. The children are more interested in playing together. As a lot of the activities in the bag, if you come over and see at the end, there's no age to them. So they're really great for sort of younger children to older children to play together. So they said that she really enjoyed the fact that all the children playing together, and they were also playing with their friends and neighbours and not using their devices. She also said the frequency of activity had changed to daily, so every day they were finding time to be active. It was now part of their daily life. Being active was part of what they wanted to do. Mum herself accessed the Halo support rate. She'd lost 3 stone and managed to reduce one of her painkillers, which also helped with her weight loss. In her words, she said, I feel better in myself, not as tired in the day. April time, I would have got up, taken the kids to school, lay back on the sofa and gone to sleep. So that's just giving you a really snapshot of active families. Next slide, please, Luke.
Before I open up to the board, just a couple of points I'd like to make. Apart from my visit to Halo on the 15th of April, singing or not singing, I've been to the Here Girls Can festival last year and was absolutely amazed at the change in some of the girls from when I arrived in the morning until the end of the session, in their confidence and the way they interacted together. I also went along to Green Spider, to the climbing wall. I did not participate, I might add, and have no intentions of doing so. But I did watch a particular. There was 4 schools on that particular morning. There was one particular little lad who, although he came with a group from his own school, was on his own. It was clear that he didn't mix very well with the other children and lacked confidence, and initially didn't want to climb the wall at all. But by the end of the session, he was climbing the wall as fast as everybody else and was interacting with all the other children in his group. And it was amazing to see what a change could be made in such a short period of time. So I really, really do appreciate the work that you are doing at Stride. I think it's amazing, and I think, you know, bearing in mind there are so few of you involved in this, it's a really, really good scheme. Anybody gets a chance to go along and have a look, climb the walls, you might want to do that. It's really worth doing. Alongside the presentations that we have got the physical activity strategy, which I'm assuming that everybody has read. And so I now open it up to questions on either or both the strategy and the comments raised by the Stride Active CRC. Anybody got any questions? David.
So firstly, a comment. Thank you. Really fascinating to hear proper stories and get, you know, a sense of the reality rather than just talk about numbers all the time, which we do tend to talk. So thank you very much for that. I've actually got a question for Lauren, actually. Do you think the GPs in Herefordshire know enough about this type of thing? And would we be able to get more information out to them as part of our kind of social prescribing work?
Yeah, I think we can always do more. I think there is quite a good connection between the GPs and Halo in terms of some of the ways that we can promote activities. We've been looking actually recently about making the practices more active. So the RCGP does a campaign to make practices active and demonstrate that, so they can sort of lead by example in the community. But I think, I mean, certainly anything you think that we can do more to engage with your teams, very, keen to do that.
Just to emphasise, I know I sit here with my VCS hat on, but I'm from Active Herefordshire, Worcestershire, and as we've been mentioned a few times, it would be worth contextualising some of the data. So there's the physical activity data, which means we're better than the national, but there are inequalities that exist within there, and the girls being further away from physical activity is part of the journey with Here Girls Can, because it's a specific inequality within the system. So it's an intervention addressed not only to really empower young women, but to address that inequality. And it's the same with the long-term health conditions. With your long-term health conditions, you are further away from regular opportunities. So the aspect that Halo are doing addresses those inequalities as well. So it's not just programs that had a gut feeling that this might work. There's strategy behind both of them in terms of addressing those inequalities. And those inequalities extend to sort of geography, and we talked about prevalence of smoking in certain areas. Leominster, South Wye, these are areas that are, again, above average in terms of inactivity. So those inequalities exist across the system, but those barriers to regular opportunity to be physically active are there as well. And these two interventions mentioned address or hope to address some of those inequalities. So less of a question, more of a, they're brilliant.
Yes, that's ourselves in Healthy Lifestyle Service. So I'm Philip Ellis, Healthy Lifestyle Service Manager. Do you want to move on to the next slide, Luke, please? So we recently took on the Ramblers Wellbeing Walks licence, and this is to build a network of walking opportunities across our county through a combination of closed and open walks. They're free to access, they're short, around 30 to 45 minutes, and they're led group walks. And they're designed to be those short, really to encourage people to come back to physical activity, just following on actually what you were saying there, Steve. About people coming back into activity, maybe long-term conditions, lost their confidence, or they want to join a group that brings activity into that. So we work in partnership with the Ramblers. It's the Ramblers licence that we hold, which Public Health purchased back in May last year. And it sits within our service. We have 5 health trainers that are trained as coordinators, and then they are able to deliver walk leader training out to anybody out in the county that wishes to set up and lead their own health walk. The couple of the photographs throughout the slides are walks that are happening across the county. They all seem to be lovely sunny days, but I will point out we walk no matter what the weather. So if it's raining, we will still be out walking. Can you move on to the next slide, please, Luke? So today, the data keeps changing. I can't actually keep up on with it. Every time I put a slide together, it changes. So we've had it's more than 48 people now. They've expressed an interest in becoming walk leader trained, and that's a combination of our community groups, our volunteers, our partner organisations. So it had been 24 people had completed their walk leader training. That is updated because we did some training last week. Some of our partner organisations are here today. We've trained up the Feel Good Life team to offer walks within their group. Some of our social prescribers and our health coaches within our wellbeing teams are trained, and they're offering groups as part of their remit. And also our Mind Link workers have all been trained up, and they're currently offering closed groups to their peer support. We're also doing some work with our Assertive Outreach team and our Mental Health Trust, and they will be delivering walks as closed walks as well. But we do have a series of open walks live on the Ramblers website, and again that is out of date because we had another walk added on Friday. So I think we have 6 maybe now active across the county, and these are led by our volunteers, so from a range of different areas, different partners, and these are the ones that we currently have on. I think we've one in Leinster now as well. So approximately around 50 people attend the walks each week, and that is growing, and we don't have any limits. So if anybody comes forward wanting to volunteer to set up a walk, we will support them with that and support that walk to encourage people to join. We're working with our partners for Walk This May coming up. We're working with Active Herefordshire and Worcestershire and our colleagues at Public Health in Worcestershire to celebrate walking and to do a joint initiative. And we're going to celebrate those walk leaders and have an opportunity for them to come together to celebrate the work that they do. Do you want to move on to the next slide? Look, I've just got some comments, and I think what you'll pick up on the theme that's come through from when we've talked about physical activity, yes, it's getting out, it's getting active, it's hitting those physical activity goals, but what's really, really strongly coming through is that social isolation, that coming together. and being part of a group. I know Mark mentioned that came through very strongly in his work, and again Becky and Sarah have mentioned that in Stride, but we find that with our walking, it's really bringing people together to get out and about, to be part of a group and to socialise, but they're getting the benefits of the physical activity alongside that. So that's just some of those comments that we have, and as I say, we are continuing to develop the walks across all areas, and you're all very welcome to come along and join us. We won't make you sing unless you want to. We finish with a cup of tea at the end as well. I can't guarantee a biscuit because I can't guarantee that from a healthy lifestyle point of view, but certainly a cup of tea at the end is always welcomed, and that time to chat. So I'm happy to take any questions around that if you want to. Thank you.
So the next steps for the physical activity strategy are the physical activity steering group remains committed to delivering the strategy and the action plan, and I think you will see that significant progress has been made since the publication of it. The plan is to broaden the existing strategy to become a healthy weight strategy. So that healthy weight strategy will include a physical activity element, a food element, environment and weight management, so that it will just become broader. But the physical activity steering group will keep oversight of the physical activity element. We will continue to provide updates to the Health and Wellbeing Board regarding progress. And the physical activity steering group will assist in guiding and informing the leisure review during this year. In addition, the physical activity steering group will collaborate with Active Herefordshire and Worcestershire to support the Place Universal Offer project, sharing research insights regarding regions with low physical activity participation. Thank you.
Thank you, and thank you to all of those who've given presentations this afternoon. If we move to the recommendations, if there are no other... Oh, David.
Just thinking about what you said there, Kristen, about the extending the, whatever you call that first strategy to a healthy weight strategy. I'd be really keen to think about how we can add in the kind of new weight loss medications that the NHS is going to be required to prescribe into that whole strategy, because we don't want to have a separate kind of social approach to this and then a separate medical approach to this. So be keen to think about how we can make sure we contribute to that, please.
Sure, definitely. We'll keep that in mind.
I just want to say really a big thank you to everyone for coming along, because it's really brought it to life in a way that I think usually we just hear a presentation, but actually hearing the voice of people who are participating in these schemes, I think has been really helpful, and I just wanted to kind of formally record that, I guess.
Going forward, we could do more of that on the Health and Wellbeing Board, because there's no doubt that actually hearing from people who are involved in this and is much better, as you say, than just reading a report and asking questions. So I shall make sure that we do more of this. That could be a recommendation, Ben. Okay. Regards to this particular item on the agenda, the recommendations are that the Health and Wellbeing Board considers the progress to date, and that the Health and Wellbeing Board considers how to ensure that all partnership organisations are clearly cited on the Herefordshire Physical Activity Strategy and reference it across their own strategies and plans. Do I have a proposer? Stephen. Seconder? David. All those in favour? Thank you. We now move on to item 10, which is the work programme, which is to consider the work programme for the board. The board is also invited to consider topics for the next board workshop development session, which is to be held, I think it's now going to be held on Friday the 4th of July. The updated work programme has been circulated in the agenda for review by the board, and if anybody has any comments on that, please let me know. further updates, as referenced earlier in the meeting, the board will welcome an annual report from the Tobacco Control Alliance on the progress against the planned actions of the Tobacco Control Plan. So that will be added to the work programme. And so, as I said before, the next board workshop has been scheduled for the 4th of July at 9:30 a.m. And would board members here today wish to identify a topic for that session? If not, would you prefer to wait and explore it further at the meeting on the 9th of June? Yeah? Give it some thought. Because we might have some more information from on high. We might. As to our destiny. And we might not. So we'll look at it again on the 9th of June, put it on the agenda for them. Okay. The work programme, I presume, is agreed with the addition of the Tobacco Control Alliance programme. So can I have a proposer for the work programme? Got your question? Yeah.
Could I just make a suggestion for a future, possibly September or December? Could we do something on work and health? Because there's quite a lot of government policy around at the moment on the relationship between work, health, benefits, etc. And I think that would make a good health and wellbeing topic to explore, particularly with some of the stuff we're doing at the moment around the Work Well project, which is trying to help people get back into work if they're off work with a health condition. So
Yeah.
Possibly September or December.
You could do that. Yeah. Anybody else got any additions they would like to add to the work programme? No? Okay, with that, then can I have a proposer for the work programme as it stands with that one addition? Hilary, seconded by? No. And all those in favour? Anybody against? No, that's it. Right, thank you very much. We're going to close the meeting.
Yes, just noting that the today's next scheduled meetings, the 9th of June, the next scheduled meeting in public.
Yeah.
Thank you.
Can I check that the live streaming is stopped, please?